When you become a physician, you take the Hippocratic Oath, saying that you will first do no harm. I am not convinced that the way we're doing healthcare in this country is doing no harm. And I have been a part of this problem. I'm actually not a physician. I'm a psychologist and a professor of community mental health. And for many years, I've worked in healthcare, giant hospital systems, tiny clinics. And throughout this time, I got really interested in what I now call behavioral prescriptions. Early on, I just called them things that doctors tell their patients they should do. And here's what I learned. Most people walk out the door of their doctor's office having been told one or more of these 4 things. You ready? Okay, number 1, you should exercise more. Number 2, you need to eat better. Number 3, reduce your stress. No problem, right? And number 4, get some social support or some meaningful connection in your life. Now, the nervous laughter suggests to me that you're familiar with these. In fact, can I just see hands? Who has ever received one or more of these from a doctor or a therapist? Oh, wow. Yeah, that's pretty much all of us. These are fundamentally good advice, right? There's nothing wrong with these. The problem is what happens next. Because these are verbally delivered, followed by something that sounds like, all right then, good luck with that, take care, see you in 6 months. Off you go, the appointment is over. And that's the end of the conversation. Now let me be clear, this is not the doctor's fault. They are doing the very best they can in an impossible system, but it's not okay. There are at least 2 problems with this. First, we have a delivery system problem because, as far as I know, there is no pharmacy in the world that you could walk into with this kind of prescription in hand, hello, and get anything but funny looks. And second, we have an equity problem. Because if you have a lot of resources and a lot of privilege, there is an entire boutique wellness industry that is waiting to serve you. And if you don't have that kind of privilege, this is a prescription to nowhere. In fact, I think it might actually be worse than that. I think this is a prescription for a feeling of personal failure and even shame when we very predictably struggle to enact these in our lives. And the shame piece is worth us talking a little more about. See, in the last 10 or 15 years, the field of healthcare has gotten really interested in what we call upstream health. And all that means is that in addition to looking at the current health problem, like, for example, we'll just say asthma, we're also looking back in time and in causality to understand what might have contributed to this. So in this case of asthma, we'd be also thinking about mold and air pollution, poor quality housing, all the way back to housing policy decisions that set some of this in motion in the first place. Make sense? Okay. We're not yet talking very much about psychological upstreamism, but I think we need to be, and here's why. Shame is psychologically upstream from despair. And despair is psychologically upstream from violence. Whether that's violence to ourselves in all the ways that we can harm ourselves or to others. So shame looks like a personal problem, it very quickly becomes a community problem. And a healthcare system that's reliably generating shame is not doing no harm. I think we have the opportunity and possibly the ethical imperative to do something different. And in 2016, Dr. Ben Emmert Aronson and I said we had to try. Together, we co-founded Open Source Wellness, which is a national nonprofit with a mission of generating what we call community as medicine. And one of the ways that we do that is by functioning as a behavioral pharmacy, or an actual delivery system for one universal prescription, which we abbreviate Move, Nourish, Connect, and Be. Now, part of what I think it means to be a behavioral pharmacy is that we don't just talk about these things, we actually do them together in community and we make it fun. And here's a little bit of what that looks like. we bring groups of patients, our participants, together to do fun, playful physical activity that's just as much about laughter and connection as it is about sweat. We practice stress reduction in ways that are highly accessible. We learn about and prepare and eat really tasty plant-forward food. And perhaps most importantly, we connect with each other in ways that are authentic and powerful. We've been doing this for 7 years now, in big hospitals, in little clinics, with employers and housing and universities. In 2024, we're going to train a cohort of YMCAs to deliver this model, which I'm so excited about. Thank you. Thank you. And over these last 7 years, we've been gathering data on the impact that this kind of work has on people, and here's what we're seeing. Our participants see significant increases in physical activity and fruit and vegetable intake. They see massive drops in blood pressure, depression, anxiety, and social isolation. And the figure that really gets the attention of our health insurance partners is that we're seeing about a 77% reduction in emergency department visits. Yeah, thank you. That's a big deal in healthcare. But just as interested as I am in that it works, I'm really, really interested in how it works. And I want to share a couple of the things we've learned about that. Here's the first one. When it comes to these big 4 behavioral prescriptions, move, nourish, connect, be, lack of information is no longer the biggest problem. It's just not the bottleneck anymore. In fact, can I see hands again for who's ever received one of these? Okay, great. And now, for how many of you, when you were told this, was your internal reaction something like, what? This is radically new information. Anybody? Yeah. For most of us, we don't need a lot more experiences of being told what we should do. We need experiences of doing it together in community and having it be fun and sustainable. And we've started to call that experiential medicine. Here's the second thing we've learned. Healthcare is full of mechanisms that are designed to protect privacy. We've all encountered these. And they're very well intended. But I think they're also a double-edged sword, in that if we're not careful, all those mechanisms can actually reinforce shame. Like, shh, I won't tell anyone that you're having a health challenge, and you probably shouldn't either. And then we're all walking around feeling like our health and wellness challenges are personal and private and something to be suffered quietly alone. And the truth is, of course, that they're not personal at all. There are incredibly powerful structural forces that underlie our chronic disease epidemic, and you know these just as well as I do. Food systems, financial systems, corporate governance systems, social systems of oppression. What all these systems have in common is that they have prioritized profit over human well-being over and over and over again. So, at Open Source Wellness, step 1 is about creating a community where we can speak the truth about what's happening in our health and well-being and be met with empathy, compassion, validation, belonging, welcome. Because when we do that, something extraordinary happens, which is that the shame starts to just evaporate off people. You can just see it lift. When one person courageously says something like, you know, it's hard to talk about, but I've been struggling with anxiety lately. And another person says, oh my God, I'm so glad you said that because me too. Shame doesn't survive a connection like that. So that's always step 1. And then step 2 is about desire. When our participants are prescribed to open source wellness by their doctors or their therapist, one of the first things that happens is they have a conversation with a coach. And at some point, that coach is going to ask a very simple question, which is, what do you want? And something predictable and beautiful happens in that conversation, and here's how it goes. The coach will say, "What do you want?" The patient will say, "My doctor wants me to lose some weight." Coach will say, "I got it. And what is it that you personally want?" The patient will say, "Well, I'd like to lose some weight." Coach will say, "Great, if that's important to you, I want to help you with that. And why do you want to lose some weight?" And this is when it starts to slow down. But the patient will say something like, "Actually what I want is to feel good in my body again. I want to have energy again." And the coach will say, "Awesome. I want that for you too. And if you had that, if you had energy again and you felt good in your body, what would be possible for you? What would be available in your life that's not available now?" And this is where there's a long pause. But if you wait, this human being will say something that brings tears to their eyes and yours. And it's different for every person. But it might sound like, what I actually want is to be able to play with my grandkids. Because right now my knees hurt and I can't get down on the floor with them and I can't keep up with them outside. I just want to survive to watch them grow up. And the coach, if they're not crying, will say, "Thank you." Because that is the kind of desire that will fuel the work of transformation. So, having created a space where we can speak the truth, the shame can come off, we can access the power that is desire, then, and only then, we invite our participants to write their own prescriptions. It's not their doctor's prescription, it's their prescription. And people write all kinds of different prescriptions. Some of them are really specific, like, "I am going to walk around the block 4 times tomorrow," or "I'm going to try a brand new vegetable this week." Awesome. But some of them sound like, "I am going to be kind to myself." Some of them even sound like, "You know what I'm going to do? I'm going to deal with my credit card statements because I've been avoiding them and it's stressing me out and it's time." Whatever it is that would make a difference for that person, we're going to help them with that, step by step, by leveraging the power of community. As we start to wrap up, I want to take a moment to speak directly to those of us who work in healthcare. See, none of us got into this field to deliver harm. We just didn't. And we would never, ever tell a patient, "You need heart surgery," and then do nothing, and then ask them in 6 months why they weren't better yet. That would be malpractice, and yet we do it every day with these behavioral prescriptions. In healthcare, we meet people, we sometimes literally catch people in the most vulnerable and frightening moments of their lives. And we have a choice to do that in a way that is transactional or that is transformational. And that possibility, truly transformational healthcare that's leveraging the power of community, that is what I stand for and what I'm committed to co-creating in partnership with you. So let's remember why we got into this field and have some bold conversations about how we do that. For all of us, I dream of the day when it's just as easy to walk into your local community as medicine group as it is to walk into a CVS. And I dream of the day that you could take your entire family, maybe 2 nights a week after work and after school, to your local YMCA or community center or church or temple or mosque, wherever it is that you already feel comfortable, and get these 4 things woven into your evening, joyfully, easily, not because you're showing up with a lot of cash or because you're exerting a ton of willpower, but because we as a society have chosen to invest in and design for these 4 things that human beings appear to be hardwired to need to be well. Thank you. So those are the days that I dream about and that I will work towards. And yet, until that day, what are we going to do? Like, wait? I don't think so, because we're hurting now. and the people we love are hurting now. So here's a place to start. If you look once more at these 4, can you identify the one that's the hardest for you? Will you just wave at me when you know which one's kind of a struggle for you? Yeah. Thank you. Yeah. For me, it's the last one. Because physical activity, I kind of enjoy it. It comes reasonably easy, but stress and anxiety, oh my God. I overworked myself into a chronic pain condition that took years to unwind. And it's still hard, and I still need help with it. The people in your life, they also have one or more that they struggle with. And you might know what it is, but you might not. So here's my invitation to you. Reach out to them. Have a conversation. Tell them what you struggle with and ask them what's hard for them. You might even ask them, what do you want? What matters to you? And when you've done that, you make a plan together. You create a simple, repeating structure that uplifts both of you. Maybe it's a walk once a week. Maybe it's a potluck once a month. Maybe it's a check-in by text every day. Maybe it's a kick-ass Saturday morning where you get all 4. We call that the Move, Nourish, Connect, Be Challenge. This is Jerry. He's one of the incredible peer leaders at Open Source Wellness. And as I've gotten to know him, it turns out that he likes cabbage and he can talk to anybody. And I'm the dork over there who eats apples and peanut butter every day, and I'm still working on the stress management piece. See, what you create for you and your community will be just as unique to you as mine is to me and Jerry's is to him. So I will leave us with this. If you are struggling with your health or your well-being, or you love someone who is, and I'm pretty sure that's all of us, it's not your fault. And the way out, it's not more willpower. It's about human connection and the social structures that we can create that make the healthy thing the easy thing. Community is the medicine, and we can create it and be it together. Thank you so much.